Let's cross down to Melbourne now and catch up with Victorian opposition leader Michael O'Brien. Thanks for joining us again, Michael. Sad news of another death today, so 7 deaths in Victoria over the past 24 hours, now the highest death toll of any state. You must be very concerned about the direction of the pandemic in Victoria, although I would say with 300 new cases today, at the very least, the trend here is that the infection curve has been flattened over the past 4 or 5 days.
Oh, good evening, Chris. Look, anytime you have 7 deaths, it's not a day to be positive. Anytime you have 300 new cases, I mean, that's still not a cause for celebration. Now, it's not up at 484. But these numbers are bouncing around a lot, and I think we still need to see whether the government has actually been able to get a hold of this tiger by the tail. Has it actually been able to suppress this virus? We're not seeing the exponential growth, and that's a positive thing, but we're not seeing the reductions back into the low 3 figures or even the double figures that I think we're all hoping for. Now, we've only just started wearing the masks. I'm not wearing mine at the moment because I'm inside, but when I'm outside, I'll be wearing the masks. That's everyone in Melbourne and Mitchell Shire. And we're hoping that these new measures will have the desired effect of suppressing this virus.
Look, I think the masks are a wise move, and we're seeing that right around the world. But you're in a serious lockdown now. The AMA are calling for even more severe lockdowns in Melbourne. I just wonder when we're going to develop a strategy for living with this virus, because you need to remember, tragic as the deaths have been, with 300 new cases in a day, that's in a state with more than 6 million people. There's not a province, a city, a country in the world that wouldn't kill for Victoria's figures.
Yeah, look, I suppose we compare ourselves to the rest of the country, and as a Victorian, it's very frustrating. We see people in Sydney and Brisbane and Adelaide and Perth getting to go back to the football, getting to go out and have a meal with friends. We can't do that. So I suppose we compare ourselves to the rest of Australia, but you're right. As a nation, we've done extraordinarily well, but there's no doubt that in Victoria, the ball's been dropped. Hotel quarantine stuff-ups has been the major factor in that. But we've dug this hole for ourselves. We have to get ourselves out of it. But you are right. At the end of the day, until there is a cure or a vaccine, we are going to learn to have to live with this virus. And that means that some of the things that Victoria hasn't been doing well, not testing fast enough, not contact tracing fast enough, we've got to improve a heck of a lot in that if we're going to, A, contain this current outbreak, but B, learn to live with this virus in the future.
There's no doubt we've got to learn some lessons from what's happened in Victoria. I'll come to those in a moment, but just a qualification. I said there's no country, there's hardly any countries who wouldn't swap with Victoria. Of course, New Zealand's done very well, and you look at Hong Kong, Singapore have done well as well. But you understand the point. There are most countries in the world are doing far worse than Victoria, let alone Australia. When you talk about the lessons, obviously quarantine is essential. It's, Blind Freddie can tell you that quarantines need to be respected. But I was very concerned yesterday with the mixed messaging from Daniel Andrews, the day before he'd criticised Victorians for not isolating while they were waiting for their test. And as we showed yesterday on this flyer, even his own staff were being told to tell Victorians that if they it might take a few days for their test results to come back, and that they don't need to self-isolate while they're waiting for their results if they're feeling OK. You've got to get this messaging clear. People need to know exactly what's expected of them, surely.
Yeah, look, Chris, not to put too much mayo on it, but this is really a matter of life or death. You cannot be too clear and too accurate when it comes to public health messaging in the middle of a pandemic. And Daniel Andrews was telling people things that his own department were not telling people. They were telling people if you are asymptomatic, that is, you don't have symptoms, but you get tested, you do not have to isolate at home. Now, the Premier's changed his mind on that, but he didn't bother to tell his own department. So I think when you look at the issues over mixed messaging, hotel quarantine, failures on testing, test results and contact tracing, there's a lot of lessons that we need to learn here in Victoria to catch up.
Now, and all of these lessons need to be learnt nationally. There's a national cabinet. We're all supposed to be coordinating here. At the top of the program, I showed how Scott Morrison said in March, and all the state premiers agreed with this, we're trying to slow the infection rate of the disease so we can deal with it. Now they are talking about preventing any community infections in Australia. That's effectively eliminating the disease, isn't it?
Well, look, it sounds very much like it. Now, I suppose, look, it's really a continuum. You've got suppression strategy, you have aggressive suppression, then you have elimination. Nobody wants to say that we have an acceptable number of deaths. We want to try and eliminate as many deaths from this virus as possible. We want to eliminate as much transmission as possible. And I suppose the lessons are, if you get the basics right, get your communications right, people understand what they need to do, and then government does their part. Government does quarantine properly. Government does testing properly. Government does contact tracing properly. When government pulls its weight, I've got great confidence that Australians will pull their weight and we can get through this.
Yes, but we have to get through it with an understandable level of infection, an understandable level of illness and death, the same way we deal with other infectious diseases. It's unrealistic to expect no infections, surely.
Look, I agree, Chris. I mean, it'd be great if we were like New Zealand. It'd be great if we were able to get to a position where we had no infections. But even the most aggressive medical experts who are pushing for an elimination strategy say they can't guarantee it. We're not New Zealand. We're a country of 25, 26 million, not a country of 5 million. And also, even if we were to eliminate coronavirus in Australia, does that mean we close our borders to the rest of the world forever? So I think you're right. We do need to learn to live with it. But certainly there have been mistakes that have been made in Victoria we need to get a handle on and make sure that they're not repeated elsewhere around the country. We've
got to have that discussion most definitely. We really have to talk about how we deal with this because the question is, you're in your second lockdown now. What happens if in September we have another 200 or 300 infections in a day in Victoria? Are you going to go into a third lockdown?
Well, look, that's the great unknown, isn't it, Chris? We don't want to have a yo-yo society, a yo-yo economy where you go from having a semblance of normality of your life, businesses open, people in work, to shutting everything down again. And that's why I think we do need to just get a handle on this current breakout here in Victoria and put in place strategies to try and limit the prospects of future breakouts. But accepting that they will happen. We need to act quickly to deal with them when they do. We've been told all along they'll happen, and so we shouldn't panic when they do. We should be effectively getting on top of them. Now, you've got the compulsory mask situation 2 days in Victoria. How are most Melburnians dealing with it? 16 today have been fined by police, was the latest advice we got, for not wearing masks. Yeah, I think my understanding is that we're only a couple of days into it, as you say. The police's view is that they're not going to fine people unless they're basically being defiant and deliberately breaching the law. And I think that's not unreasonable. I mean, nobody likes having to wear a mask. I don't like having to do it, but I do it. I do it because I want us to get through this breakout. I want us to get back to a semblance of normal life. I want to see friends and family. I want to have go back to work, be able to go out to a pub. That's the price we're going to have to pay to get through to the other side, is to wear these masks, is to follow the rules. And look, I think that the police, they've got a tough job, but look, they deserve to be supported. And some of the idiots we've seen on social media today, frankly, letting themselves down in a very big way. Michael O'Brien, thanks for joining us.